Great, so thank you so much, and there are exhibits for both of our speakers today. I want to introduce Greg Mays as he pulls his slides up. They have a really interesting clinical trial going on with staccato alprazolam. Help me here.
Alprazolam.
Yeah, what he just said. So this is going to be really interesting. He works with Engage Therapeutics, and I think he's ready to go.
I think so.
You're up.
Okay, great. So hi, welcome. Thanks for coming to this talk. I'm actually going to step down here one quick second. So I'm going to introduce you to an inhaler we have that we're developing called staccato alprazolam. Alprazolam is a generic version of Xanax that has been on the market for decades. It's also part of the benzodiazepine family.
I'm sorry to interrupt, but can you use the mic because they are filming?
Okay, I just want to pass this.
Oh, okay, great.
So here's the inhaler. I'm passing the inhaler around just so you can get a feel for what we're doing. But we're developing this inhaler that will have alprazolam, generic Xanax in it, part of the benzodiazepine family of products which have a well-established history of terminating and preventing seizure activity. The only issue that's been with them over time has been how fast do they act. And they're generally used to prevent seizures after one seizure happens. So some folks are familiar with the nasal sprays that are in development. There's one product on the market which is called Diastat, which is rectally administered. But again, those products work slowly, so they're for repetitive seizures. We believe, and our hypothesis, and why I came from Summit, New Jersey to Orange County, California today, is to get the word out about this product. We have an ongoing 100-patient trial. If you walk straight out of here, we have a booth on the left, Engage Therapeutics. We have a patient brochure, additional inhalers, and we need to find patients that have long, regular, predictable patterns of seizure. Because we believe that with this product, our hypothesis is that if you feel a seizure coming on, this product can be taken out of your purse, your briefcase, your suitcase, and will rapidly, you take one normal breath of the inhaler, and it will stop your seizure activity, and you'll remain seizure-free for a period of hours. So one thing I didn't mention in my opening, it was just a brief little background there, is sort of why did I get into this company. 2 years ago I started this company. I'm the president and CEO. My most important title is I'm actually a father of a child with epilepsy. And that's how I learned about it. I spent my entire career in drug development, pharmas, biotechs, almost exclusively in the cancer oncology area. In 2014, when my oldest son was diagnosed with epilepsy, we went to take him to the NYU, New York University's Langone Comprehensive Epilepsy Center, and he was treated very well. He's been seizure-free for a couple of years. But I got to meet Dr. Jackie French, Dr. Orrin Devinsky. Dr. Orrin Devinsky was on Carey's trial. He's recently associated with the approval for EPIDIOLIX in the CBD trial. And Jackie French is the Chief Scientific Officer for the Epilepsy Foundation. So they said to me, I said, thank you so much for helping getting my son's epilepsy under control. How can I help you? And they said, well, you can get involved in this group called FACES, which stands for Finding a Cure for Epilepsy and Seizures. It's primarily New York City based. And and occasionally they would call me with sort of a business pharmaceutical question. And 2 years ago, Jackie French called me and said, Greg, what do you do when your son has a seizure? And I said, I do absolutely nothing. There's nothing you can do. We ride the storm out. Of course, we're trying to make sure he's safe. He's not falling down. He's not hurting himself. But in terms of stopping the seizure, forget about it. She said, yes, I know. But she said, I think I found a product, an inhaler that works fast enough. I've tried this on 5 patients at NYU in an induced photosensitive seizure model that Carey talked about with his product earlier. And it had rapid seizure abortion. Within 30 seconds, there were clinical observations that the seizures just dropped. So I got into this because, there's a huge unmet medical need. Nothing works fast enough. One of our company's slogans is, it's about time. It's simply about time. I think we're going to work, we work under the same hypothesis that the other benzodiazepines work, but this inhaler works so fast that Jackie saw rapid seizure abortion within 30 seconds in her 2A study, And then we would see a period of 5 to 6 hours of seizure freedom afterwards. Get the GABA receptor reset, and the patient would be okay. So I love this opportunity. I was so thankful I got a call about this. My son has epilepsy, and here's something that has an unmet medical need and could truly be the security blanket, like an EpiPen is for people who have anaphylactic reactions, because it works that fast. You'll carry this inhaler everywhere. We thought it had demonstrated efficacy. Again, at Jackie's study showed 80% reduction in seizures within 30 seconds. So, and then I can tell you that we've already started a phase 2B study, which is why I'm here today. Because like Carrie was saying, it's like the phase 2A was sort of an open label study. People knew they were being induced with a seizure, flashing lights, they would get the seizure, they'd be given the inhaler, and the seizure would stop within 30 seconds. Okay, that's great. Of course, what the FDA is going to say is, we'll say, how does that work in a randomized placebo-controlled study? So right now we're looking at it with placebo and then also with the active. But the first 8 patients were part of a pilot study. We wanted to make sure that we had this kind of operating right in the epilepsy monitoring unit. And I can tell you, the first 8 patients, 5 of them were complete responders with evidence of seizure abortion within 30 seconds and a Tmax of 2 minutes. So we're really happy about that. I think that this product has a great way of getting to the market and could potentially be a tool for you in your lives and in your dealing with epilepsy in the future. Why? This inhaler has already been approved by the FDA, and I told you how alprazolam has been on the market for decades and is well established. So I'm basically combining an approved inhaler as well as approved product. Just real quickly on this, these are the people that helped inspire this opportunity. I mentioned them to you. I didn't mention the individual in the middle, Warren Lammert. He also is a father of a daughter with Lennox-Gastaut epilepsy. He's a former chairman and president of the Epilepsy Foundation, has done a lot. He is the one who personally looked into this product opportunity with me. Orrin, far to the right, is not only my son's epileptologist, but again, he actually just got named Time Magazine's 2018 top 50 people in the world who have impacted healthcare with the approval of Epidiolex, and Jackie French really needs no introduction in that she's been associated with a driving spirit behind virtually every epilepsy product. There's myself. I've told you basically what I bring to the table is 20 years in clinical development and product development expertise in pharmaceuticals, but the gentleman to the far right is also my partner in crime. It's Dr. Yoko Isoyarvi. He's been a epileptologist and a drug developer. He's associated with the development of Keppra. And so he's our chief medical officer. In sort of the interest of time, I'm not going to get too much into the market overview. I mean, we all know sort of the epidemiology of epilepsy. 3 million approximately in the United States, 2 million who are well controlled. But I do believe that the patients who are even well controlled are going to want this product. My son's in college now, thankfully. But if I had this product, I'd stick this in his backpack and say, look, if you miss a dose of medicine, you're stressed out, you didn't get a good night's sleep, okay? Take a breath of the inhaler, reset, let your AEDs catch up with you and balance it out. I mean, he also is a hiker. I mean, this summer, they're like, I checked the box, he's got epilepsy, and then they're like, send the rescue treatment with you on the hike. I'm like, there is no rescue treatment that I could send with him. I mean, there's things that would maybe prevent a second seizure, but in the future, I could see this, becoming just sort of, again, that security blanket that all patients with epilepsy need. I mean, I think the biggest fear is the fear of the unknown. When am I going to have my next epileptic seizure? So whether your seizures are controlled or uncontrolled, I think there's a place for this product. This is where this product is going to play. I mean, I think you guys probably understand basically from what I've been saying, but there's no out-of-office treatment that's going to stop a seizure in the prodrome or a stage, okay? But we do know that there's 20 types of aura that people get. Again, flashing lights, gastric upset, smelling burning rubber. People know when they're going to have their seizures. Well, if you've got a minute or two warning, you're going to take the inhaler out, take a puff, and it's going to stop your seizure here. You're never going to enter into the ictal phase, and you're going to remain seizure-free. We also think that there's a huge opportunity for this product development for epilepsy patients because, and I've seen them already out here today, but the technologies and devices that are being developed to detect and predict a seizure too, particularly the prediction ones. So in the future, they're predicting that in 5 to 10 years, people, your iPhone or your iWatch is going to tell you, hey, Greg, you're going to have a seizure in 5 minutes. Well, that would be extremely stressful information if you didn't have a product like Staccato Alprazolam that you could say, okay, watch is telling me seizure, get out the Staccato Alprazolam, take a breath, and then it would shut down. It would be the same sort of warning system that some people still have now. This is really the secret sauce. This just shows you how the product, you pull the tab out, the green light lights, and within milliseconds of a breath, this product goes into the deep lung and into the arterial blood system, blood flow, and right to the GABA receptor. That's our secret sauce. This slide shows you from the 2A trial that we tried with 5 patients. You'll see this is one patient with 5 doses, but not surprisingly, you'll see there that the ones that these were all their seizure levels, the high bars, and when they took the product, they were almost immediately eliminated. The adverse event profile of the product is extremely tolerable. Sedation and tiredness is sort of what you get. This slide tells you about the current trial we're doing. It's called the STATE study. And if you're at all interested, please stop by the booth. I need people associated with epilepsy to help a man who's trying to bring an epilepsy product forward. I need patience. I need to get this study funded while I'm still funded. I went out and raised $23 million to get this product off the ground. And now I'm on the clock, so to speak. I've got a period of funding, and I've got to show results by the end of that period of funding. So if I don't get patients, I'm out of luck. But here we're doing 100 patients, a couple doses, one with 2 milligrams and one with 1 milligram, and then placebo. But we call it the STATE study. Why? It's called Staccato Alprazolam terminates epileptic seizures. Just a little bit about the study. The key entrance criteria is we're looking for people with generalized epilepsy that have bouts or episodes of absence or myoclonius epilepsy for 5 minutes or more, partial onset seizures with a minimum duration of 3 minutes, and then people who have 2 or more seizures in 2 hours. Basically, we need patients that have longer seizures, frequent seizures, and they have an element of predictability to them. The phase 3 study will be done in an at-home environment and will be a feasibility study to show that we can use the product at home. This is just, basically I was telling you the key facts. We've already dosed 8 patients. We have another 100 to go. We just started the randomized portion of the study. Out of the first 8, we thought we had great results. I think sort of to Carrie's view, I was interested in your statistic there about 70%. We have 62.5% responder rate, and we hope to have the data in this trial. This trial needs to be done in the second half of next year. I talked about the technologies, and let me see if you got a second, let me see if I can pull this up here. Cannot locate, I'm not on the internet. Okay, well, you're gonna have to stop by our booth because I'm gonna play it for you. And then here, if you want to take a picture, I don't know if there's anybody in here from an investigator site. We have 20 sites set up right now. We're looking to get to 40. So UC Irvine, and we're going to be at UCLA. UCLA is starting. We are also talking to other sites here today. But if you have a physician, an epileptologist, neurologist, or could just spread the word, we are still looking for some more sites. They can contact me, gmaze@engagetherapeutics.com. If you're interested in joining the study, you can go to engagetherapeutics.com. It'll take you ultimately, if you want to be a patient or you want to consider your eligibility, to a website called epilepsyhealthstudy.com. And there you can complete the information on your epilepsy, and a neurology nurse will review that and stay in touch with you to determine your eligibility and where you could go for as a site. Anything else? There's my cell phone number. Yes, I'm the CEO, but it doesn't stand for Chief Executive Officer. It stands for Chief Enabling Officer. I need to get into the weeds on this, and we need to get this study involved. So anyway, I'm sorry, I guess I'm not connected to the internet here, so it's not playing, but we have a 1 minute patient testimonial of a patient that literally had myoclonus epilepsy. She took the product, it stopped within 30 seconds, and she did not feel tired or anything, and she speaks very glowingly about her experience. She was one of the first 8 patients on the product, and we're really excited. So thank you for your time and commitment to it, and if I can, I'll be here to answer any questions, or we have a booth outside. Thank you.